Hi, team. My name is Selma Nunez, and I'm a dietetic intern at Texas Medical Center. And today I'll be presenting a clinical case study on Elsie, who was a 32-year-old archaeologist that was admitted with severe gastrointestinal symptoms, multiple complications, and malnutrition. Elsie is a 32-year-old English archaeologist and has spent the past year searching Mayan ruins for the lost cave of the Jaguar god. She discovered an iron coffin holding the Maya warrior queen, Lady Snake Lord. Born into an aristocratic family, Elsie faced early loss and knows little about her medical history. She studied at elite schools and earned a PhD in archaeology from Oxford. Elsie loves treasure hunting, mountain climbing, and fast motorcycles. She follows a strict vegan diet, exercises daily, and avoids smoking and alcohol, but struggles with insomnia. Elsie initially experienced vague gastrointestinal symptoms over a 3-month period, including nausea, abdominal distension, weight loss, and epigastric pain. A local clinic diagnosed her with gastritis and prescribed antacids, which did not improve her condition. Over the past few days, her symptoms escalated to fever, night sweats, diarrhea, and a worsening rash on her legs, which prompted her to seek emergency care at our facility. Elsie's medical history is extensive. She has Crohn's disease, which led to the removal of approximately 79 centimeters of her terminal ileum, affecting nutrient absorption. Additionally, her vegan diet predisposes her to B12 and iron deficiencies, which worsened by intestinal resections. Her history of multiple traumatic injuries, chronic pain, hypothyroidism, and ADHD add complexity to her nutrient management. Understanding her pre existing conditions is essential in shaping effective nutrition interventions. Elsie is not a typical patient, as you can see. Several organ systems were impacted during Elsie's hospitalization. Disseminated intravascular coagulation caused abnormal bleeding symptoms. Additionally, her hantavirus infection contributed to pulmonary edema, leading to respiratory failure. Her renal function shows signs of dehydration. And in the gastrointestinal system, a mechanical small bowel obstruction required surgical removal of the duodenum and jejunum. These systemic effects complicated her nutritional needs. Her diagnostic journey revealed the presence of Ascaris roundworms, causing mechanical bowel obstruction and ischemia. Imaging showed dilated loops of the bowel and curvilinear structures, consistent with parasitic infestation. Surgical intervention included the removal of the duodenum, necrotic jejunum, and the bezoar mass. And end-to-end anastomosis was performed to reestablish bowel continuity. Each of Elsie's intestinal resections has a major nutritional implication. Terminal ileum removal disrupts B12 and bile acid absorption, leading to fat malabsorption. The duodenal resection affects iron and folate uptake, increasing the risk of anemia. And the jejunal resection impairs the absorption of carbohydrates, proteins, and fats, which requires a highly digestible enteral formula post-surgery. To help Elsie heal, doctors and dietitians had to take a comprehensive approach, making sure she received the right nutrients, supplements, and dietary support to strengthen all of her body systems and support her long-term health. She requires a 1,600 to 1,900 calories per day to regain strength and maintain her weight. Since protein is critical for healing, she needs 80 to 100 grams of protein daily to help rebuild muscle and tissue. Hydration is just as important, and she needs 1,600 to 1,900 milliliters of fluid per day to keep her electrolytes balanced and prevent dehydration. By following this plan, we can help her recover effectively and improve her overall health. Elsie's vegan diet, active lifestyle, and potential genetic risk factors require carefully chosen formula to support her overall health. Her GI function, nutrient absorption, and macronutrient balance must be considered, ensuring proper fuel for her high energy activities such as treasure hunting and mountain climbing. To ensure she gets the nutrients she needs, we use a continuous feeding through her PEG tube, delivering 60 to 75 milliliters per hour. This slow and steady approach helps her body process nutrients without overwhelming her digestive system after surgery. Vital was selected due to its peptide-based composition, which improves digestion and absorption for patients with short bowel syndrome. A continuous infusion was chosen to enhance tolerance. The prescribed volume ensures adequate calorie and protein intake, with water flushes every 4 hours to maintain hydration. By carefully evaluating these factors, Elsie can maintain her adventurous lifestyle while ensuring her diet supports her physical and mental well being. For Elsie's nutrition plan, enteral feeding is a key part of her recovery. Since her body has trouble absorbing nutrients properly, a peptide based formula like Vital can help by making digestion easier. Although another option is Jevity, it requires careful monitoring to make sure she tolerates it well. As Elsie prepares for discharge, she's required education on nutritional adaptation post surgery. Given her vegan diet, she needed B12, iron, and calcium supplementation due to malabsorption risk. Her nutrition plan will play a crucial role in her recovery. One of the most important steps is making sure she gets enough protein to help her body heal and rebuild strength. Since she follows a vegan diet, her protein needs must be met from plant-based sources like soy and legumes. To meet her daily goal of 80 to 100 grams of protein, she can also incorporate protein powders into her meals. By staying consistent with her high protein diet, Elsie can support her recovery, rebuild muscle, and maintain her overall health as she transitions back to her regular routine. Additionally, sunlight exposure was recommended to boost vitamin D levels naturally. As Elsie recovers, her diet needs to be carefully adjusted to avoid digestive discomfort. At first, she should follow a low fiber diet since too much fiber can be hard on her system after surgery. Over time, she can slowly add more fiber depending on how well her body tolerates it. And instead of large meals, Elsie should eat small, frequent meals throughout the day. This helps reduce the stress on her digestive system and lowers the risk of dumping syndrome, which is where the food moves too quickly through her gut, causing nausea and other issues. By making these adjustments, Elsie can support her recovery, improve digestion, and get the nutrients her body needs. Because she lost part of her ileum, she can't absorb vitamin B12 properly, so she will need regular B12 injections to prevent deficiencies. Additionally, a high dose of vitamin D is necessary to maintain bone strength and immune function. Since her body struggles with absorbing nutrients, she'll also need calcium and magnesium to support bone health and prevent weakness. To help with overall nutrient absorption, she must take fat-soluble vitamins A, D, E, and K, ensuring her body gets everything it needs for proper healing. With the right supplement plan, Elsie can improve her energy levels, bone strength, and overall recovery, helping her feel healthier and stronger over time. And most importantly, keeping track of Elsie's labs is essential to making sure her body is absorbing nutrients properly and catching any deficiencies early. This case emphasizes the importance of personalized nutrition therapy for patients with complex medical histories. Early enteral nutrition, formula selection tailored to malabsorption, and nutrient-specific interventions were instrumental in her recovery and ability to return to an active lifestyle. This case highlights the critical role of dietitians in optimizing post-surgical patient care. Regular blood tests will help doctors and dietitians adjust her nutrition plan as needed and make sure that she gets the right balance of vitamins and minerals to support her recovery. As a dietetics intern, I want to thank the entire comprehensive care team for their time and expertise. I hope we are continuously dedicated to patient wellness, and your insights and collaboration have been invaluable as we shape the well-rounded nutrition strategy that will support recovery and long-term health of patients like Elsie. I welcome any follow-up discussions, strategies, and questions to continue optimizing patient care. I'm aware that working together, we can ensure the best possible outcomes and adapt nutrition plans to meet evolving needs. I hope to connect soon. Take care.